Thanks so much, Daniel. Can you guys hear me okay? I'm going to take that as a yes. Hey, welcome everybody, and thank you so much for taking the time. We'll spend 30 seconds talking about ourselves and what we do, just so that you have a bit of a context. My name is Alex Nasrin. I'm one of the founders of RevenueWell, and a bunch of you are actually customers of RevenueWell at this point, as far as I can surmise. Some of you are using a different patient engagement, patient communication solution. But if you're totally new to the scene, RevenueWell is a company or a service that sits on top of your practice management software and acts in a few capacities. We help attract new patients. We help manage the patient relationship at scale through patient outreach and patient marketing. And we really help optimize a lot of the patient-facing practice processes that, quite frankly, are sometimes clunky without somebody in the cloud getting involved. Things like revenue cycle management, things like patient intake, things like payments and telephony and things like that. So I'll show you a few examples of this today, but before I proceed, I want to kick it off to Lori. Lori, can you chat a bit about what you do?
Sure. My name is Lori Dietrich, and I work for West Monroe Partners. West Monroe is a consultancy based out of Chicago with offices throughout the country, and I work in the healthcare and life sciences practice. I've been with West Monroe for about a year, and prior to coming to West Monroe, I worked in DSO operations for about 10 years. So I bring that perspective of the DSO side to the conversation, and have had some experience personally in terms of implementing teledentistry. So I look forward to sharing some of my tips.
That is awesome. And so, between the two of us, hopefully what we can get to cover today is, the business case for teledentistry. We're not going to spend a ton of time there, but I think it's useful in today's context to understand, what environment are we operating in, and what are some of the practices doing that is very, very successful in teledentistry. I will spend a bit of time talking about the technology landscape for these types of solutions. What works out there, what are the pieces, and what is the sort of the capability maturity model that involves. Before we get to going into all of that, I did want to make an acknowledgement. This is, as Daniel is telling us, one of the bigger webinars that they have to date, and one of the reasons why is because we are in a situation that we're are today, and so I don't necessarily want to spend time, unpacking CDC stats or citing cases or ADA guidance. I mean, you guys are on the ground. You definitely live all of this. The thing that I did want to acknowledge, just on a very personal level, is how disorienting these times can be for literally everybody on this webinar. We have Planet VS, who's an amazing partner of ours, and is a company that's at the forefront of cloud-based practice management systems. We have a bunch of DSOs on the call who are generally a lot more well-versed in technology, and yet it's pretty difficult to figure out a way to make things work. We have some single location practices. We obviously have RevenueWell, who's been at the bleeding edge of patient engagement, and we have West Monroe Partners, that is a huge thought leader in healthcare IT and tech-enabled services and things like that. And frankly, none of us have been in this situation before, right? Nobody has any data to pattern match against. And, this is where the power of dental community really comes into play, and where we've seen firsthand the benefits of working with so many tech-forward, thoughtful practices that in many, many ways are guiding our product marketing and product management decisions for both Planet DDS and RevenueWell. And all I wanted to say is that we realize the situation that everybody's in, and we are committed to getting through this together and making this actually work. So with that aside, I did want to talk about, why teledentistry and why it's relevant. And the argument that I'm hoping to unpack today is that this has actually been a long time coming. This is not something that sort of sprang on us. There's definitely a lot of acceleration that happens in today's environment. The truth is, the world will have changed by the time that this crisis passes, and there's going to be a lot of demand out there for services like this. But one of the things that I wanted to unpack, and if you haven't been doing a lot of research on the subject or practicing teledentistry before, sometimes it's pretty difficult to understand what are the use cases and why should we consider this, and frankly, what happens after the crisis passes, and what is the role of teledentistry in modern healthcare. And so I wanted to talk about this from two different perspectives. One of them is a clinician perspective, which many of you on the call are doctors, and you got into the profession for the reason that it is the right thing to do, and you really care about patient health. There's also the operator perspective, which if you're a part of a DSO, if you're an executive, if you're a marketing director, if you're an operations person, you definitely also care about what does this do for my business, and how does it make me successful competitively and otherwise in the coming years. So a few things to note. One of them is from a clinician perspective, there's definitely a huge aspect to teledentistry when it comes to emergency triage. And I'll touch a bit about on the COVID-19 situation, but generally what we've seen really successful practices do is use teledentistry as a way to actually impact the patient experience and clinical outcomes with this. So a little bit of blood on the PowerPoint slide never hurt anybody, but this is a very typical example of how teledentistry can actually make a difference in a clinical outcome for somebody, right? Your kid is out there on the soccer field, then after their tooth out, a lot of times it can take you an hour or 2 or 3 to actually go see a doctor. And in the meantime, how fast you act, how you ice it, how you implant the tooth back in, you guys know this better than I do, makes a lot of difference in what can happen. So one of the key applications that we've seen happen is, if you can get your doctor on the phone, if you can get your doctor, on a video chat or some other way to communicate, they can really coach you through the experience a lot faster. In fact, a better outcome, and most importantly, be there for the patient at a time when it matters most. I have 2 kids, and if one of them had a tooth knocked out, I would be freaking out, and I would really appreciate any kind of guidance that I could get in this situation. The second piece to this is a practice lifestyle, and this is a stock photo of a family barbecue that I swiped off the internet yesterday, but it's kind of the phone call that every doctor here on the webinar dreads getting, right? Like the second you've gotten your family situated, the second you go away on vacation, the second when you think you're done for the day, the inevitable phone call comes, right? And it is, hey, I'm in severe pain. I have an abscess. I knocked my tooth out. Something else happened. Can you please drop everything else that you have going on in your life and come see me? And in a lot of ways, this is why you're in the profession, and you should be there for your patients. But in some other important ways, there's got to be a way to make this a more manageable situation for everybody involved, and figure out how to triage this to understand, is this an event that needs attention clinically right now, or is this something that can wait till tomorrow? Is this a quick script that could be written for them? Is this a quick, just ice it, put a tea bag on it, don't worry about it type of a situation? Do some Oragel. And so we've seen practices really impact the provider's lifestyle by giving the capability to jump on a telehealth, teledentistry type of a session, and effectively figure out whether they need to see the patient right away versus not. The third aspect of it is accessibility, and so there's a lot of debate in public health around access to dental services in more rural communities, where the patient to provider ratios are not all that, where people sometimes lack access to childcare, lack access to transportation, where maybe it takes 50, 60 miles of a drive to even get to the doctor. And so in these kinds of populations, or especially when they're elderly, for example, as well, it's fairly difficult to always be there for them when an emergency hits, and again, do so in a timely manner so that the patient outcome is the right kind of outcome. And there's also the what's happening today. The picture is actually my friend Yanis. She's a doctor here in McHenry, Illinois, and this is how she goes to work now, when she has an emergency. So it's definitely a public health situation right now, and one where the world of dentistry has changed a bit in terms of why you choose to see patients, what protective equipment you use while you do all of that. And so in today's environment, one of the biggest applications of teledentistry is we need to be able to be there for our patients when they need us, but also very effectively triage them to understand, is this a practice type appointment, or is this something that can be resolved remotely? There's a few considerations there. One of them is PPE. and the inability for your practice in many cases to get your hands on any. So you really want to reserve the protective equipment for people who need it most at this point. The second consideration is obviously, keeping everybody involved. You want to keep your team safe, you want to keep yourself safe, but you also want to keep your patients safe. All of us could be carriers of COVID for all we know right now, no matter how we feel in the present moment. And so any capability that we can have to not come into the practice without this being an absolute necessity is definitely the right thing to do. So this is probably the most acute way that we see practices start using teledentistry today. I'll speak a little bit more about the RevenueWell aspect of this solution, but we've added a virtual visit capability, to our practice marketing platform very recently, about a week ago, and we have thousands of these sessions actually happening. And so it's been a very, very helpful part of the technology stack for the practices. But there's also pieces of it that will stay, when COVID passes, right? And those are, treatment case follow-up. And so again, like when you think about people who are immunodeficient, when you think about people who lack access to care, when you think about people for whom it's a little bit more challenging to get to you, you start really exploring, what does it mean to always have the patient in your practice versus actually doing some of the routine follow-ups and, case consultation and collaboration virtually, right? So one example could be, you just placed an implant on somebody and, you could very well do with a routine checkup, where the patient can actually show you the site, where they can discuss their symptoms, to all that. If you're talking about a treatment case, and especially when it comes to elective procedures, it is a very realistic option, and we'll discuss this in a bit, right? But if I wanted to get some Botox right here, if I wanted to talk about a bridge right there, if I wanted to talk about clear aligners, this is definitely a consultation where at least the first consultation can definitely happen virtually, which has been a godsend for providers in this environment. The second perspective that I want to discuss is the operator perspective, and this is where we have to talk about a different place. One of them being the defensive play, and then the offensive play. And the defensive play is really this: your patient base is the most valuable financial asset that you have, right? When you think about how your practice is even valued, especially when you're a part of the DSO or looking to become a part of the DSO, for example. It is definitely a sum of all future cash flows that are projected for the patient base. And so it's really about handling the crisis and handling the emergency in a way that fosters loyalty and trust. What you do over the next couple of weeks and months is going to really define the value of this financial asset. And I don't know what metaphor to bring to this, but, like 2 years ago, my heater, my HVAC blew out on Christmas Eve, right? And my usual guy couldn't make it. And guess what? We no longer work together, but the person who was able to make it, I'm telling everybody who will listen about how awesome they are. And I will always pay what they tell me to pay on my own house, simply because this is how trust is actually getting built in these times of crisis. It doesn't even have to be something this extreme. It could just be, some normalcy that you're able to offer your patients when they're calling all of their providers and can't really, get through to anybody. The offensive play there is, according to all predictions, and Lori can probably do a better job of speaking about this, but according to all predictions, teledentistry is here to stay. Dentistry is generally lagging a bit behind healthcare when it comes to the implementation of new tech. And so there's huge signals out there coming out of the general healthcare community that this is here to stay. And so our prediction number one, if I was to dispel predictions, is that teledentistry is going to follow the path of laser dentistry, CAD/CAM, sedation dentistry, even to an extent, patient communication solutions, which is they were novel at first, and then nobody wants to practice without them again, and they become a very, very competitive differentiator, a big one for DSOs and single location practices alike. The prediction number two that I would make is that DSOs will figure out, especially DSOs, will figure out a way to harness the power of teledentistry in a more of a centralized fashion, both for cost containment purposes as well as to actually aid in new patient generation and conversion efforts, right? There's something very compelling about schedule your virtual consultation here versus coming to the office, especially if you're here, drive there, spend the time, do all that stuff. So what does it take to get started? One of the things that I wanted to flesh in front of you as a way to somewhat think about how organizations go through change management. This, capability maturity model is an old one that was done seriously like 3 years after I was born in '84. And it's a Department of Defense model for, thinking about how do companies go from an ad hoc, unorganized, process, whatever that process may be, all the way to this is a real thing and it's being optimized and it's really working for the organization. And so, I would argue that, we're currently in this initial stage, which is, like you're really scrambling to try and figure out how to have these conversations with your patients, how to get connected and get engaged, how to do some of the coordination of care. And so what I'm arguing is that, we can really get to, places of, managed and defined, managed being you actually have the technology solutions for this, and defined as in like you will actually have practices around it throughout your organization in the next, 6 to 12 months. Whether we're going to be quantitatively measuring these processes or even, thinking about optimizing is up for debate. But I think you can get to number 2 and 3 first. And so from a technology standpoint, it really boils down to the following. So we do have, level 1 technology capabilities, which is basically what you have today, which could be Zoom, FaceTime. In a lot of ways, these are not HIPAA compliant solutions, but they are ways for synchronous teledentistry. So get on the phone, get on the video chat, and actually chat with a person. Planet DDS is amazing in the sense that it is a cloud-based solution, so you always have remote access to your patient data, which is incredibly useful. For those of you who are on, Open Dental, some of the Shine solutions, some of the Patterson solutions that are premise-based, this is definitely a bit more of a struggle, and this is where we've seen practices employ remote desktop access solutions and things like that. There's also levels 2 through 4. I'll just cycle through all of them really quickly. And level 2 is really being able to just open your doors for business when your practice is closed. So potentially a dedicated phone number that rings when you're away from the practice. Some sort of a capability for real-time coordination. Perhaps via text. And then moving up the security curve to a HIPAA-compliant video chat capabilities. And so this is something that we're doing with RevenueWell today. Level 3 of capabilities are actually opening this up and thinking about this as more of a holistic practice versus just a way to engage with your patients. And this is where you can actually get an appointment booked when you can, in the states that require it, get teledentistry consent forms filled out electronically, get new patient registration, get health history updates, where you can do some revenue cycle management components, share files back and forth, and even market this to your practices. And so, we'll show you, a few glimpses of today is, some of the level 2 capabilities as well as level 3 capabilities as RevenueWell provides them. There's also the level 4 piece, which I'm not sure that anybody in dental has quite figured out yet, but it's really about how do you now start include some case collaboration, how do you start e-prescribing, and then especially in the on-prem solutions, how do you do electronic charting without full access to your practice management software? So I'm going to try and flip over to a different screen here. Let's see if that happens for me. And show you a bit of how we've seen this play out in, with RevenueWell customers as an example. So, when we talk about level 2 capabilities, and these are just to have broad capabilities to deliver teledentistry, it really boils down to a few things. One of the things that we will be able to offer is remote access to your calendar. And so this is something as simple as looking at your calendar in a mobile optimized beautiful view to where you actually know per operatory who is scheduled, right? And so in today's environment, we can't a lot of times access our schedule. So a lot of RevenueWell customers are using this as a solution to say, hey, who was actually scheduled for the day? And, whether I need to reschedule them or if I'm now migrating to a telehealth or a teledentistry consultation instead, I can easily do this inside of this interface and actually know who's on deck. The second piece of this is a desktop text messaging platform. And I say desktop, it could be a mobile app that we provide. It could be mobile optimized. But this is a way to give your patients a lifeline of communication to where you can very, very quickly say, hey, how are you feeling? Right? And this is something that hits the patient via text. It actually comes in right through the practice phone number, and the patient can easily text back. And so this is where I'm going to pause for a second, because it is also a place where you can then engage in several modalities of communicating with the patient. One of them, and this is a key RevenueWell capability, is being able to just straight up call the patient right from your browser. So right now I'm on my phone. My phone, as you guys will see, is ringing. This is the practice calling, and it's super easy to communicate this way. And so if you have several staff dispersed, across their houses, and and no access to the practice phone line, this is an incredible way to actually still get connected without using your personal cell phone, which is not HIPAA compliant, which is not convenient, which is sort of exposing their personal information out to the patient base. But the second piece that I think is very cool here is that right out of this, patient view, you can also initiate a very quick telehealth session, right? Very specifically here, what you do is you send the patient the text message that comes in on the phone, and as you tap that, you can very easily join the session on the mobile device, as I'm going to do right now. Although my phone is probably not going to allow this as I'm dialed into the webinar. But the point is, it is that easy to initiate a session and actually unpack a lot of your concerns with the doctor or with a member of staff, and this is a HIPAA compliant capability, and it is super easy to do, right? So this is the kind of technology that is available and out there today. There's also the level 3 capabilities that we discussed a bit, and this is where some of the bigger parts of the RevenueWell platform come in. One of those capabilities is talking to your patients about teledentistry. And so those of you who are customers of RevenueWell, it's a very easy thing, and you've gotten accustomed to this. But essentially, you can very easily communicate to your patients at scale. Giving them tips on home prevention, giving them announcements about your hours and how your practice is operating these days, but also at the very broad level, announcing teledentistry capabilities to your patients and give them the ability to schedule their appointment online, for example. So what you're looking at right now is the broader RevenueWell platform, which a lot of the over 7,000 customers all over the country have. How they've guided us over the last couple of weeks is, guys, sometimes we need the full thing, but also could you abstract the level 2 capabilities into a separate product so we can sign up for this? And so that's exactly what we've done. But when you talk to us about the general marketing platform, that's the one that will have some of the level 3 stuff with payment processing, with social media curation, with communicating to your patients at scale, and all of that. So obviously we'll talk about this more later on, or if you choose to reach out, but that's some of the stuff that's been really, really helpful to people. So I think the technology piece of it is important. I think the in some ways bigger thing that people care about is, what are some of the gotchas? What are some of the underwater rocks for actually implementing telehealth in my practice? And for that, I'm really happy to have Lori on the phone, who's done this quite a few times and has amazing advice for you. Lori, I'll kick it over to you, if you don't mind.
Thanks, Alex. Thank you.
Mm-hmm.
So you can go ahead and go to the next slide, Alex. So Alex has given you a lot of information about kind of being ready to implement teledentistry and some of the reasons why you would want to do that. And I want to share with you some of the arguments that I've heard over the last few weeks from dentists that I know and why they might not want to. So I'm just going to kind of briefly go through some of these with you and give you some of my comments. So one of the arguments that I've heard is the reimbursement just isn't enough to make it worth it for me to mess with it. And I would say that it is true that teledentistry is not going to float your practice during this time. And even after COVID-19 abates, it's not going to be a significant revenue source for you. But, I think there's a couple of questions to ask yourself. One is, at this time, isn't some revenue better than none? And this is a way to drive yourself some revenue. And in the longer term, is it really about the money, or is it about staying connected to your patients and really serving them now during a crisis, and also having that service offering that they're going to expect later on? So I think that's, we're going to talk a little bit about social media advertising in a minute, and some ways that you can really connect with your patients, but I think that's an important aspect. Another argument I've heard is I don't normally see enough emergency dental patients to make it worth it, to do this on teledentistry. And that might be true, but really the priorities right now in the face of COVID is just keeping people at home and keeping people out of emergency rooms. One of the interesting statistics that I've read is the American Dental Association says that every 14 seconds in the United States, someone goes to an emergency room for a dental problem. That was before COVID. So now that about 1 in 5 of all dental offices is completely closed without seeing emergencies at all, I'm certain that that number has increased. So even if you're only successful in keeping a handful of patients in your community out of emergency rooms through teledentistry, it's worth it. You can advance this. Oh, I'm sorry, these are all on the same slide, Alex, sorry. The next one is, once this is over, I want to make sure people keep coming in to see me. I don't want them to think that this is the new way that I'm going to treat patients. And of course, that's true. Teledentistry, without a lot of advancement in robotics, is not going to see, we're not going to replace in-person dentistry. But at the same time, we just can't expect that things are going to go back to the way they were before. And Alex also referred to this as a prediction, that there will be a new normal. That collectively over the last several weeks and over the upcoming weeks, our society is moving to expect to be able to operate more digitally, and teledentistry and telehealth will be expected services. So I really believe that those of you who are embracing it now are going to have a competitive advantage later. Of course, all of us have the fear of getting sick, and the more you're in your office, the more likely it is that you could be infected, and that's completely understandable. It's also true that if you go to the grocery store, you could be infected, and it's a scary time right now. And hopefully, if you are able to treat patients in your office and you're using universal precautions and you're using the CDC guidelines for sterilization, etc. And if you're using teledentistry to pre-screen patients, then you're more likely to be able to keep patients out of your office who are actively sick. The last argument that I've heard is I'm a dentist in Texas, and I saw somebody bring a question up about this already that I can't argue against, because Texas law does not allow for teledentistry, and even in the midst of COVID, they are not allowing for teledentistry. So if you're in Texas, you can't provide teledentistry at this time, which is very unfortunate. You can move to the next slide, Alex.
Yep,
so I liked this quote from the American Teledentistry Association. Now is the time for dental health professionals to join our medical colleagues and public health officials in containing the COVID-19 pandemic. With simple tools like smartphones and laptop webcams, dentists can see the most vulnerable dental patients safely in their homes, thereby eliminating their risk of infection. I really want to, bring home the point around the public health service element that dentists can play in this time, and how important I think that is. You can go to the next one, Alex. So I think there's kind of 6 basic areas in which you can ask yourself some questions to get up and running on teledentistry fairly quickly. And the comments and the tips that I have are really going to keep you kind of in that sort of phase 1 and 2 of the maturity level scale that Alex showed you. And then I think there's longer term things that you can think about that will get you up into those 3, 4, and 5 levels. But for right now, we're trying to be expedient. So I think in a technology way, Alex has reviewed that. There's technology questions that I'm not going to go into today, but certainly Alex and I are happy to answer questions for you after if you didn't get them answered this morning. There's legal and risk questions related to laws and malpractice requirements. Of course, you want to know how to bill and how you're going to get paid for this. What is the protocol? How am I going to do this in my office, and how do I train others? How do I let my patients know that I'm going to be providing teledentistry? And what are some of the public health resources that I can access or that I can communicate with to let them know that I'm available? Next slide. So the next two slides are just a visual of a document that will be sent out to you following the call, and it's basically a checklist of things that you can go through on your own, and it encompasses these 6 areas, and I'm going to go through them in a little bit more detail, but not on these slides. So you can go ahead and go to the next slide, Alex.
I think we're there.
Yep. So starting with talking about some of the regulations, it's really important, I've referenced this twice on this slide, that you check your individual state dental board, your state dental associations, and your specific malpractice carrier for information. But these are some of the general regulations that have changed in the face of COVID. So one of the biggest ones is that HHS has indicated that they will waive penalties for HIPAA violations during this time, while people are implementing telehealth and teledentistry, as long as you're acting in good faith and any infractions are inadvertent on your part. So they've listed for you some of the apps that you cannot use and some of the apps that you can use. And so it's pretty liberal at this point, the tools that you can use pretty simply with your patients to engage in teledentistry. Before COVID, you were not able to see new patients via teledentistry. Most states required that you could only see existing patients, whereas that has now been suspended, and you can see patients for problem-focused evaluations. I'm going to talk about coding in a couple of slides. I know that question has come up, and so we'll talk about the codes, but I've listed a couple of them here in this example. Before COVID, dentists could not see patients that did not live in the state that they were licensed, whereas in most states right now that has also been relaxed and there's not the same focus on state lines. Normally you need to have a patient sign a consent form to have in the chart related specifically to teledentistry. Currently the doctor is allowed to chart that in the notes. And finally, the DEA has stated that DEA registered prescribers are allowed to prescribe controlled substances via telemedicine. So next slide. So this is regarding coding. A couple of tips in the to-do list, just making sure your practice management software allows you to bill for these codes as well as accept payment for these codes. And just making sure it's up to date in that way. Consider for your patients that are coming in without insurance, just charging a flat fee for this. In this particular day and age, you might not want to charge for that, but in the future you could. And then set up a way for them to pay online. And then again, just contacting your individual payers to make sure that you know their specific regulations around teledentistry and what they are and they are not reimbursing for. I did link here on the slide that you'll receive after the webinar. The ADA has compiled responses from many dental payers as to what they are paying currently for teledentistry in the midst of COVID, and again, that document is linked here. So there's not very many codes that you can bill for in terms of procedure codes during teledentistry. There's 4 that are the 4 that you can bill for are listed here. In addition to one of these 4, you would bill for one of the 2 teledentistry codes listed here, 9995 or 9996. We're talking today about 9995, which is synchronous teledentistry or real-time encounters. There's also a store and forward method of teledentistry that we're not really discussing today, but that's billed under 9996. And so for any encounter, you're going to have 2 codes, or at least 2 codes, one procedure code and one teledentistry code. Prior to COVID, most payers did not pay for the teledentistry code. It was just a method of tracking. But currently they're relaxing that and they are beginning to pay for those codes. And so you need to figure out what you're going to bill for that amount. And at the bottom of this page, it gives you some guidance from the ADA as to how to determine that amount. The next slide. All right, so this is, again, will be part of the checklist that you receive, but it's basically sort of the in-visit things that you might want to consider making sure that you're checking off for each visit. So there's some pre-screening items, and then there's some in-visit items that you might want to, again, just take note of while you're going through. Basically, you know, the guidance for telemedicine is you want to have the same conversations and the same interactions with your patients via video or phone or text that you're having in person. So, you know, another of the payer changes that I neglected to mention is that some payers previously were paying different rates for procedures done via telehealth, whereas now most payers are paying the same as they would for an in-person visit. So I think you can look through these on your own. I don't necessarily need to go through these one by one, but again, and this is also something you can use to train other people in your office, other associates or staff. And then depending on your EMR, which, you know, Alex also, you know, talked a little bit about different types of EMRs and what's accessible to you at home versus what's maybe integrated with these tools. Probably what you're going to use to stand up quickly is not going to be integrated with your EMR. That's something that you would want to look at long term. Otherwise, you know, it's just going to be too cumbersome. But I think in the short run, it's not that difficult to work with a teledentistry tool that's not integrated with your EMR. And I've listed here some tools and tips that you can use to get paperwork out to patients if they're new patients, or if you need additional you know, information that they need to fill out. There's a couple of ways here that you can do that, either for people who do have the ability to print at home and the people who don't have the ability to print at home. In addition, there's a link here to an actual consent form that's been put out by the ADA for teledentistry specifically, and you know, you can use that as a model. Again, it's not required right now, but it would be something longer term you would want to implement. And then you'll need to figure out how to save your images to your EMR. So if the patients are texting you photos or they're sending, you know, you're having a video chat, making sure that your technology is recording those and that you can transfer them into the medical record. Next slide.
Yep, we're on communications.
Awesome. So Alex talked about communicating out to your patients. Of course, if you have a patient communication platform such as RevenueWell, you're going to want to use that to get the message out. There's other platforms as well. And then, of course, if you don't have that, you can use an email blast of your own. You can do a text blast. You can do a snail mail approach. And this here is just a letter that would be an example of something that you could use to notify your patients. And to give them some instructions around what you want them to do if they do have a concern. Next page. So I talked a little bit about social media. I would say first and foremost, if you don't already have social media accounts in like Facebook or Instagram, that you should create them. They're very important in terms of communication. And if you do, then you can post something really simple. I literally put this together in 3 minutes. You can just create something to post on your pages that's very simple, that lets your patients know that you're providing teledentistry and that you know, how they can contact you. As we talked about, you want to set up a dedicated, you know, number for this. Your patients that have already liked your page are going to see this automatically, and then it's very inexpensive to boost these types of posts on social media. So you can tell Facebook, for example, how many people you want this to reach on a daily basis, and what, you know, how far from your office you want them to be, and what gender, what age, etc. And then you can set that up on an automatic basis so that it hits their feeds as well. Next slide. And so as far from a public health perspective, again, I feel, you know, hopefully that you'll get the message today that this is an area that you can really lean into this COVID crisis for however many more weeks or months that this goes on for us. Of course, none of us knows. But you can, there's some things that you can do in terms of letting your local health systems know that you're available if they are seeing patients in their emergency rooms or their urgent care centers, that you can be contacted to do that type of treatment or triage and schedule in your office. Enroll in your local and state text alert systems, register with your health departments that you are an emergency provider during this time. We talked about social media, reaching out to your colleagues who maybe are closed altogether to offer to help their patients, obviously with the understanding that you're not going to steal their patients at the end of this. And then potentially reaching out to large employer groups in your area to let them know that you're providing teledentistry to their employees who might be working from home or furloughed. So those would be some ideas for you in terms of involving in your community at large. And the next slide. All right, so just a couple tips to make sure, obviously, that you're testing your location before you engage in a teledentistry session. Make sure it's good lighting, that you can, have a good conversation with the patient, that your camera is positioned well, you don't have, personal information sort of showing on the camera, that type of thing. It's helpful to let your patients know that if they have a flashlight with them when the call happens, and if there's someone else there who can hold the phone to take photos or take a video or even retract their cheek if you need them to, that's a helpful tip beforehand. And then just courteously turning off all sound notifications on your devices and asking them to do the same so that you're not interrupted. Next slide. So this is the last slide. This is just some links to helpful resources for a lot of the information that I covered today, going into a lot more detail. The ADA has put out some really good information about teledentistry in a lot of areas. So I would encourage you to go to their website if you haven't already. So that's what I have today. Alex, I'm hoping that I know there's a lot of questions coming in and I haven't had a chance to kind of review them yet. So I don't know if you want to start with some of the ones that are more applicable to you, and then I can get caught up here.
No, 100%. Thank you so much for that. So there's a bunch of people asking whether the slides will be available. Again, a reminder, we will be sending this out. We will make sure that all buildings are working. There's a wealth of information that Lori is providing in there, and we want to make sure that you have full access to this. The questions are very lively, and they truly span the gamut from public health and policy all the way to technology. One of the ones that at the base layer people are asking is like, hey, how is teledentistry defined in the first place? And there's probably not a Wikipedia article in there that makes it super easy to define, but the two aspects of it that are very important is understanding two concepts. One of them is synchronous teledentistry, and the other one is asynchronous. And so the synchronous teledentistry is a way for us to interact with our patients in real time. So this could be done with a video chat capability. It could even be done over the phone, for all that matters. Whereas asynchronous is something where you're sharing information with the provider as a patient for them to potentially help or diagnose you in a remote session. So one of the capabilities inside of RevenueWell, for example, is every patient has their login into the patient portal, where they can upload an image of the problematic area or of their smile if they're looking for a cosmetic consultation or things like that. And so, Lori made some amazing points about flashlights, about, actually, getting somebody else to help. I was actually trying some of this on myself, and it's amazing what 12 megapixel of phone camera can actually do from a diagnostic standpoint. The image quality on these things is pretty unrivaled. So again, teledentistry is a way to provide these kinds of consultations and sessions remotely, and it could be either synchronous or asynchronous. Some of the other questions had to do with technology and the integration of it. So, for example, the kinds of solutions that I showed you today from RevenueWell are compatible with most major practice management systems, right? So if you're needing to see your patient information, if you're needing to get their contact info, if you're needing to see your schedule, Planet DDS is definitely one of them, and they've been a great partner, but also Open Dental, Dentrix, EagleSoft, PracticeWorks, some of the other ones are included as well. We're amazing partners with both Henry Schein and Patterson Dental on the integration side, so you can always count on our solution, and frankly many others as well, to be fully integrated with the practice management software, so it's all up to date. HIPAA compliance is another question that sort of came up. There's definitely been a bit of a relaxing of policy when it comes to this. So prior to COVID-19, you couldn't use, publicly available tools like FaceTime and Zoom and things like that. And, this is where the foresight of our regulatory bodies is evident right now, because they're basically relaxing some of that and saying, no, you know what, just give them the care that they need right now. And whatever tools you use for this right now, without even worrying about patient records, without documenting these things, just, be out there for your patients. But it's really a short-term solution. And the long-term solution is definitely one that's A, integrated, and B, is as HIPAA compliant as the rest of your practice is. Lori, were you able to pick up anything that you feel like needs to be answered? out of the Q&A?
Sure. So I think a lot of the questions we did cover, and a lot of the questions were about links, which are provided in the deck that you'll receive. So let me think here. So I think one of the questions, a couple of the questions have been around Texas and whether or not it's okay to go ahead and use the teledentistry modality, even though it's not reimbursable in Texas. I wouldn't want to provide guidance on that. I think that you should probably contact your state dental board and find out their opinion on that. And because I don't feel comfortable kind of providing that kind of legal guidance to you as to whether or not it's a modality that you should use regardless of payment. Somebody asked if they should notify their malpractice insurance if that they're going to be providing teledentistry. I think you can find out pretty quickly if you look on their website what their perspective on teledentistry is. If you can't, then I think it's great. It's probably the best advice would be to be cautious and just to let them know that it's a service that you're starting that you haven't had before, and just make sure there isn't anything in addition that they need from you. Let's see. Somebody asked
There's
about
also,
recording. Sorry, go ahead.
No, I was going to say, like the pieces that came through in a few questions have to do with billing for this. So I think, Lori, this is where your guidance on what codes to use and how to do this in your practice management system is very useful. Again, ADA has a whole PDF of guidance for how to do this, and so we'll send this out after the fact. But it's also just setting up workflows inside of your practice management software to actually know, okay, like when X happens, here's what you do. When Y happens, here's what you do. And so this is where, if we come back to this, capability maturity model, having some of that documentation is going to be very important. And so if you're a DSO, it's definitely a highly leveraged activity that you should do, as to provide this kind of guidance to all of your locations. If you're a single provider practice, may actually even be more important to you because you lack some of the muscles around rolling out process and documentation, things like that. But, a quick staff powwow, hey guys, we're offering teledentistry right now. We rolled that out to our customers. Here's what kinds of things we do, and here's what the kinds of things that we don't, and here's how to bill for it. And so, the front desk definitely plays a pivotal role in that.
Okay, thank you. A couple of logistical questions that people asked. One was whether or not it's okay for patients to record the sessions, and that is actually on the checklist that you'll receive. Is that as a part of the pre-visit, I would recommend that you ask people not to record the session. I mean, obviously you can't, you're not physically there, so you can't make sure that they're not, but I would document that you ask them not to. I'd also ask them if there are other people in the room that you are aware of who's there. It's just sort of protecting yourself type things that you just want to kind of cover at the beginning of the appointment. And again, those are on the checklist. Somebody asked, as the administrator of the practice, am I able to provide any of these services, or does it have to be done by the dentist? It does have to be done by the dentist in order to bill for that. I do know practices where administrative staff does triaging, but then that's not reimbursable. So, of course, depending on how you divide up the sort of the duties in your practice and how you set your protocol, you can decide that. But the actual evaluation needs to be done by the dentist. Another question was, sorry, there's so many questions.
Lori, one of them on the technology side that sort of came through is, about integration to your practice management software. And so one of the fine people on the webinar basically goes, hey, I'm using a smaller PMS potentially that is not integrated with RevenueWell right now. Can I still use teledentistry solutions? And so the answer is, at the level 2 capability, and I keep referring back to that, where you have basic texting, attended phone lines, the ability to make and receive phone calls from your browser, and the ability to do virtual visits is very much a capability. So the pieces that are going to be lacking, obviously, is contact information inside of the system and the ability to see your schedule specifically. But the ability to reach out to the patient by just typing in their phone number and sending them a quick link to initiate the video call is definitely there. So we've actually been getting a lot of inquiries, from dentistry for sure, but from all over healthcare, basically saying, hey, you know what, we don't care about the integration with Epic right now. Can we just use this pretty please, because our patients need it? And the capability is definitely there. So don't let that deter you.
Yep. Another person asked a good question about whether or not you can bill for teledentistry if you're only using your phone, and the answer is yes. You can bill for phone calls, and this is actually, I think, really relevant because I'm sure that all of you doctors have been taking emergency calls your whole career and never gotten paid for them, and this does offer you a way to be able to get paid for those calls. So I think that's one good point.
Laura, you did have a suggestion before of, the amount of fee that you think is appropriate for a simple consultation, or like how, I guess, let me rephrase the question. How would you think about, in patients who are not covered or lost their insurance due to all the furloughs and stuff that's happening? How would you think about charging them for teledentistry?
Yeah, I mean, I think it's a really personal decision. If this is an existing patient in your practice, you might want to decide that you're not going to charge for the service if they've lost their benefits because you want to retain them as a patient just out of goodwill. If it's a new patient, like I said in the slide, you might want to decide that you're going to charge a $35 or a $50 flat fee for a teledentistry visit. I think the standard is usually around $25 to $50 for a telehealth fee, for a flat fee. So, you could decide to do that. But I think it just really depends on kind of your philosophy right now.
Okay. But the reimbursement is more, both the reimbursement and the fee would be somewhat the same based on, phone only or phone plus video capability, as you would guess, right?
Yep. And I think another important thing is just to figure out, there's that part of it that you want to figure out in terms of what are you going to charge a patient who's not covered. Then there's the other part of it that you want to figure out around what do I want to charge payers for the 9995, 9996 codes that typically have not been paid previously. I don't really know what to advise you on that number. I think you might want to check with some of your colleagues who might have already billed for those codes. I suppose you could just say $500. I think it's probably going to be like $50. I don't know, but I mean, I just don't know what to guide you on that in terms of a number.
Mm-hmm. And I think a very similar, question that was asked around, if I speak with a patient several times, do I bill them separately? And this is where, again, I think the personal decision of it will, and being able to make that assessment and determination, based on case by case basis is going to be important, right? So there's not a, hey, I left a voicemail, $35, I left another voicemail, another $35. It's what is the service that you ultimately want to provide, and what do you think a fair fee is, and you sort of go from there. Again, it's not a solution that's miraculously going to replace access to patient, right? But it is a solution that can give you a bit of a revenue stream, but most importantly, keep your patients healthy and productive, and the reputation of your dental team intact.
Mm-hmm. Yeah, somebody asked if you should bill if you have a patient contacting you multiple times throughout a day on the same issue. I wouldn't bill separately for each issue if you're just having brief conversations on the same problem. Another really interesting question I do want to comment about came from somebody who said they work at a community clinic, and that a lot of the patients do not have the technology required for teledentistry visually, and so whether or not they can prescribe antibiotics. That I think that the answer is yes. I would want to check with your state dental board on that question, but also just for your information, if any of you out there are working with community health or nonprofits, there is a new grant through the FCC where they've allocated $200 million for providers to be able to set up telehealth, and part of that is for ongoing monitoring of patient conditions in which you need to provide your patient with some kind of equipment. So in dentistry, that's a little bit of a stretch because you're probably not having to monitor somebody on an ongoing basis, but it is something to look into. And my email's on the presentation, and I'm happy to answer questions about that particular topic if anybody has them after the fact.
Yep. We also got a few things around, again, some of the roadmap capabilities when it comes to teledentistry, and then specifically to RevenueWell. And so this is definitely an area that has a huge, level of energy and effort, pretty much with every software company right now, right? So Planet DDF is definitely there. thinking about how to make it easier for you guys. You know, with RevenueWell, we straight up dropped a few things and plugged in really heavily into this. And so there's a ton on the roadmap when it comes to teledentistry services. You know, one of the questions was about, hey, are these sessions being cataloged and recorded? And this is definitely something that's on the roadmap. You know, another item there is taking screenshots, you know, being able to annotate a conversation as you go, and so that simultaneously have a video chat and a chat where you can shuffle pictures back and forth and things like that. And so, you know, the product team at RevenueWell has been on a real tear lately when it comes to introducing these capabilities. You know, we have a list of session recordings coming out this Friday, I believe. So definitely chat with us. I think if you reach out and sort of get another quick spin through the software, we'll be able to talk through what are the current capabilities, as well as how do we think about the product evolution in the short term as well.
Yeah. Well, I think that we've kind of gone through most of the questions, Alex. So again, I think both of us have probably provided our contact information with the deck. So please feel free to reach out to us if you have questions as follow-up. And it's been great to share information.